like to introduce a couple special guests. We have Alan Whitten with the Ohio Project. We have Chris Littleton with the Ohio Liberty Council. And soon, Maurice Thompson with the 1851 Center. Now today is a great day for Ohio. Representative Sears and I have introduced into the House the Ohio Healthcare Freedom Act, and Senator Rendell has introduced into the Senate the companion bill. Now, what are the provisions of the Ohio Healthcare Freedom Act? It seeks to protect two essential rights. First, it protects the person's right to participate in or not any healthcare system, and it prohibits the government from imposing fines or penalties on that person's decision. Secondly, it protects the right of individuals to purchase and the right of doctors to provide lawful medical services without government fine or penalty. The Healthcare Freedom Act would place these essential rights in the state constitution. Now, why should Ohio's Constitution protect the rights of patients to pay for their individual medical care? Well, single-payer systems like Canada make it illegal for citizens to go outside the government healthcare system and contract for their own medical services. The Freedom of Choice in Healthcare Act would make this fundamental provision of Canadian-style single-payer healthcare unconstitutional. Patients should have the right to pay directly for medical services with their own money. When consumers control the dollars, they make the treatment decisions. When government controls the dollars, they make treatment decisions based on not as what is best for the patient, but as what's best for the government. The effects on the state. The Patient Protection and Affordable Care Act, Obamacare, will bring significant fiscal damage to Ohio's budget. Currently, especially when taking into account the current money spent on Medicaid. Expanding Medicaid will continue to put pressure on Ohio's budget, and you may have heard that we are facing an $8+ billion deficit. And Ohio today spends nearly 40% of its money on Medicaid. It's projected by 2014 Ohio will see a jump in Medicaid rolls from 20 to 30%. This would be unsustainable, especially in the budget crisis we face today. The National Federation of Business predicts that Obamacare's employer mandate will result in a loss of 1.6 million jobs by 2014, with 66% of these jobs coming from small businesses and a real GDP contraction of approximately $200 million. The Cato Institute calculates that Obamacare will result in $669 billion in new or increased taxes over the first 10 years. In the current fiscal crisis, Obamacare tax hike will prevent job growth, stifle small business, and postpone economic recovery. Now, some on the left are going to say to you that we are trying to kill grandma. Well, the truth is just the opposite. With Obamacare, patient care will worsen and there will be restricted access. The consequences of government making medical decisions are often dire and sometimes deadly. In New Zealand, breast cancer patients were blocked from life-saving drugs because it cost too much. In Sweden, the wait for heart surgery can be as long as 25 weeks. Again, I don't know about you, but if I have a heart problem, I want to be seen this afternoon, not 6 months from now. And in Canada, more than 800,000 patients are currently waiting for medical procedures. December 7th, the Fox News channel aired a report on an alarming study that found that 74% of doctors plan to retire, go part-time, or seek other employment in the wake of Obamacare. If this exodus of physicians is true, this would mean less care and less quality care for patients. Again, a recent University of Virginia study shows that Medicaid patients who need surgery are 13% more likely to die than the uninsured, Again, 13% more likely to die than the uninsured, and 97% more likely to die than those patients with private insurance. Medication patients are 50% more likely to die after bypass surgery because of poor follow-up care. And the Medicaid patients with cancer are 2 to 3 times more likely to die with the disease. Now I'd like to let Barbara Sears have a few words.
Thank you very much, Representative Maag. I'd like to take a moment just to recognize some of the fellow representatives that we have here with us today. And I hope I got everyone as they were coming into the room. We have with us Representative Adams, Representative Beck, Grossman, Booz, Buck, Combs, McCain, excuse me, sorry for that.
That's right, John.
Goodwin, Sherrickson, Hayes, Rosenberger, and Brenner. Did I get everyone? Wonderful. Thank you very much for being here. I would also, before I would start, like to thank John McAvoy for coming down from Toledo. I'm sure he had an interesting job. He is, or drive. He is with the Ohio Project up there, and we've been working together, and we'll be working more closely together in the upcoming months. Thank you very much for attending this press conference. It's an honor to work with Senator Grendell and Representative Maag to put forth this resolution. This resolution is a fundamental reason why Senator Grendell, Representative Maag, and I were elected to our positions. I have often heard that we are elected by 110,000 to represent 11 million Ohioans, and I believe that it is an honor and a great responsibility to be in this position. This resolution is about our statement that we can represent Ohioans, that we know more about Ohio than Washington, D.C. does. It's about letting Washington know that we are not the same as Maine or Florida or Hawaii or Alaska. We are Ohio. Our state has and should keep its state rights. Additionally, it's about recognizing that within Ohio, our families and our communities are not identical. We are not cookie cutter. Communities and families have unique personalities and qualities. We have rights and responsibilities that should not be taken from us by our federal government. We have heard much from our president about health care reform being a deficit neutral to the federal budget. In fact, we have heard that it will reduce the deficit. Intuitively, that sounds illogical to me. I've spent more than 25 years of my life as an insurance representative, ripping apart insurance numbers, arguing with underwriters, and I have never found a way to offer more benefits to more people and spend less at the same time. That being said, he is our president. I say I'll trust him on that point. What he doesn't say is what this is going to do to the state. It will not be deficit neutral to the state, nor will it be deficit neutral to our families. I just recently have introduced House Bill 11, 12, and 13, while I'm in the process of doing that, in the Health Committee. All three of these pieces of legislation involving healthcare reform and trying to make our healthcare system in Ohio work better for us. And the healthcare reform adds so much stress and weight to our budget, as Representative Maag has already indicated. Currently, our state is facing a serious budget issue, with Ohio's budget being upwards of 40% of Medicaid programs, going to Medicaid programs, and now with federal health care reform, it's estimated will add $1.5 billion to an already very stressful budget. I believe, and I hope that you will too, that we have a responsibility to those that we represent to answer the question and evaluate the costs, benefit analysis prior to signing up with any federal health care plan. Although health care reform often gets reduced to cost and benefits, it's much more than that. At its core, it's about state rights, individual freedoms, and the very foundations of this country. We read and create laws, papers that make promises. I believe that Ohioans expect us to read and understand those promises, and I believe that we have a responsibility to protect our rights and the rights of our Constitution. It's really quite simple. We are counting on Ohioans to agree, and on November 8th of 2011, we are counting on them telling the federal government that Ohio is Ohio and that we can control our own destiny. With that, I hope that I didn't duplicate too much of Representative Maag's comments, and I will pass it on to Senator Grendell. Thank you.
Thank you, Representative. First of all, thank you all for coming here today. I am dealing with my own health care choices this week, as you can tell from my voice. First of all, let me thank Lynn Crow from my staff for all her hard work in getting this coordinated, and the Senate staff for their assistance. It is a pleasure and an honor to work with Representative Sears and Maag on this issue. And let me acknowledge some other folks who are here, because this is really bringing together the House, the Senate, and some folks who have been working on this issue for the last year. Again, there's Alan Witten here from the Ohio Project. Maurice Thompson is here from the 1851 Center. You'll hear from him shortly. Chris Littleton is here from the Ohio Liberty Council. He's the president. John McAfee is here. Jason Milhalik, Victor Smith, Nancy Chandler, Carolyn Alarman, and Wendy Sizemore. And as you'll see in a minute, we owe a debt of gratitude to all of them for their dedication to this issue. At the forefront of the problem with the federal health care law, so-called Obamacare, is one of which my constituents repeatedly mentioned to me and bring to my attention. And that is the requirement that all Americans are forced by this federal statute to purchase health care or pay a fine. The health insurance mandate is inconsistent with U.S. Supreme Court rulings that prohibit the government from forcing Americans to get health care. If the government cannot make you get health care, how can the government make you pay for insurance for the health care that you have a constitutional right to make the choice yourself? Now, when this situation came up last year and Obamacare was pushed through the federal Congress, we made an effort in the Senate to try to put this issue before the people of Ohio. We tried to go statutorily in a constitutional amendment. And unfortunately, there was no support in the then leadership of the Ohio House. And if there's any validation of the wisdom of Ohio voters when they elected these fine gentlemen and to change the House leadership to Speaker Batchelder, you are going to see it in this legislative effort. Because as a result of the inability for the legislature to move forward and put on the ballot the opportunity for Ohioans to protect themselves from this federal unconstitutional mandate, then you had to have the efforts of the Liberty Council and the wonderful efforts of the Ohio Project, citizen efforts, taking it on themselves to go forth, seek the signatures, to put on the ballot the amendment to allow Ohioans to effectively make their own decision, to have their own choice when it comes to health care, and to opt out of these unconstitutional federal mandates. They have worked diligently and they've obtained hundreds of thousands of signatures. The federal government has never forced all Americans to purchase any product, because not only is this dangerous, but as a constitutional lawyer by trade and experience, I can tell you it's unconstitutional, and at least 2 federal judges agree. Unfortunately, with the federal government constantly attempting to gain additional power over the lives of citizens, we, the state government, as an equal party in the United States federal system, must take a stand to protect our citizens from the abuses of the national government. Towards this end, SJR 1, the companion bill which was introduced in the Senate yesterday, seeks to bring to fruition the hard work of the Ohio Project and the Ohio Liberty Council by placing on the November 2011 ballot an amendment to allow Ohioans to opt out of the federal health care mandates. SJR 1 also will protect Ohioans from any future effort to impose a Massachusetts-style mandatory health care system, so-called Romney Care. In this respect, it is a bipartisan protection of Ohioans, whether it be from the Obama side of the aisle or the Romney side of the aisle. Ohioans should not be forced into a mandate. They should have their constitutional right to make their decision. And in fact, SJR 1 places this amendment in Article 1 of the Ohio Constitution, which is the provision in the Ohio Constitution that protects the individual liberties and freedoms of every individual Ohioan. In light of Congress's continued insistence in passing overreaching health care reform, despite the overwhelming majority of voters who opposed it, I believe it's important that we act now to protect Ohio citizens from the federal government's attempt to overreach its powers. SJR 1 will offer Ohio citizens the opportunity this fall to vote to protect themselves from this federal government intrusion into their personal freedom, and places on Ohio in an advantageous position to defend its state sovereignty and the individual liberty of Ohio citizens against this unconstitutional federal mandate.